So welcome everyone to another episode of Real Estate Mogul MD. My name is Bob Bosick. I'm a retired executive and I have the privilege of speaking with medical professionals, high income earners and investors. And we're here today to share the real world journeys along with the to-dos and probably more importantly, the not to-dos. I know there's a lot of learnings from that as well. It's my pleasure to have with us today, David Keynes. He's a physician and I believe you're in the New Hampshire area. Is that correct?
Yeah, Massachusetts and southern New Hampshire. Exactly.
All right, terrific. And a urologist, is that right also?
You got it. You got it.
All right, terrific. Well, David, it's a real pleasure to have you here. It's always interesting to hear the path that people have taken and the lessons that they've learned. And when others listen to that, there's always some benefit to it, or usually there is. So I'd like to just kind of start at the beginning. When did you decide you wanted to go to medical school? How early did you know that that was going to be your path?
I decided very early on. We're talking about like as a child visiting the pediatrician. I kid you not. I have a very vivid memory of being in the pediatrician's office and then in the exam room, and I had a sore throat, and the doctor's asking me all these questions, and in the back of my mind, I'm thinking to myself, you better give the doctor the right answer, because if you don't, he'll think you have something else that you don't have. So, which is kind of like a twisted thing for like a 5-year-old. Yeah. But I was in total amazement that there was this person who knew so much about the human body. Now, in retrospect, I was coming there with nothing complicated, but I was fascinated that somebody could learn about the human body and then somehow be of service to others. And it was just something that I always thought that I would do. I entertained other things.
It never waned.
Well, I did entertain other things briefly. In college, I interned at one of at that point, it was the big six accounting firms. There are no longer six of them, but I worked at Ernst & Young back then, where my father was working at the time as an intern. And I saw all these frustrations that people had in their professions. And I thought, well, at least if I get, that thank you from a patient, I'll know that I'm doing something worthwhile. I was completely, enamored with that whole idea.
How long was that internship before you had this level of awareness?
Yeah, that level of awareness happened like after 4 weeks or something. I looked around at these professionals who were like in the mid-career or maybe even late career, and they just didn't seem happy. Yep. And, when I volunteered as a college student in the local pediatric emergency room, and doctors seemed happy. Now, we can talk later about whether I think that's what current college students would observe about us now. I do think about that a lot. And unfortunately, I don't think it's exactly the same scenario. But back then, I saw people who were really filled and engaged.
So where did you go to medical school?
So I went to medical school at Cornell in New York City. Mm-hmm. And my path towards urology it went something like this. There's a huge fork in the road in medical school, and it's usually in the first month when people are doing gross anatomy, where medical students decide if they're going to go down a surgical path or a medical path. I don't know if it's still this way, but I suspect it might be. The people who tend to be completely in love with gross anatomy gravitate towards surgical fields. Yeah. And then some people are completely repulsed by it and tend to gravitate towards medical fields. Obviously, that's a generalization, and so it's probably wrong on the edge cases. But I was in love with it. I mean, I would stay in the anatomy lab well beyond closing time, and I saw the surgeons come through, and they would come and tutor us in anatomy, and I thought, man, this is definitely what I'm going to do. I'm going to do something with my hands. I couldn't believe that we were even afforded the privilege of being able to dissect another human body. And I still feel the same way about that. It's really kind of a magical experience. And there were some surgeons who at that time saw how interested I was and sort of whispered in my ear, you really ought to think about surgery. And they were right. It fit my personality. I like conquering bite-sized tasks. I like immediate problem solving. And I enjoy hands-on experiences. So that was a perfect fit for me. The urology aspect of it is a little bit more bizarre. I mean, most people don't go into medical school thinking they want to be a urologist. Right. I personally didn't even know what that was. And like most things in life, it had to do with crossing paths somewhat fortuitously with some very grounded, very influential mentors who I just saw them and thought, that's what I want to be. And it just so happened they were urologists. But, urology attracts a certain personality. You have to have some sort of, I don't know if it's sense of humor or humility or some character trait that lets you find humor in what a lot of people would find agonizing topics of discussion.
Right. Yeah. I imagine.
So all my colleagues are fantastic people, and I think I can't exactly put my finger on it, but there's some common character trait that attracts urologists. And so part of choosing a specialty is enjoying the subject matter, but also enjoying your colleagues. And so that's how I ended up in urology.
Yeah, I understand. I often tell people, and what I do is that I'm at a unique place in my career, and one of the filters that people kind of have to be able to walk through. There's about 4 of them, but one of them is I have to like you. I'm a little gray, as you can tell, which means I've done things once or twice in my life, and when you're early in your career, you don't get to be as selective as perhaps you'd like to be. But now I do. And being around people you like that are smart, and challenge you and bring something to the plate intellectually, personally, emotionally, those are probably the most important thing in a workplace, to have that value of those kind of relationships. So I agree with you 100%.
Yeah. I love the way you phrase that. I mean, your work is like a second family. If you don't enjoy the people who are around you, you're toast. It's not going to be.
No, you're going to be gone. You'll eventually leave. Yeah. So what's the biggest challenge you faced, on your journey from medical school to now? What did you learn from it?
I'll tell you, the biggest challenge is a blind spot that I had, and I suppose it's a healthy blind spot, of not thinking about what it would be like once I finally reached the goal that I've been chasing for so long. And when I talk about this topic, I feel like I always have to give a brief caveat. Like this sounds like a first world problem. And it is. I don't want to sound ungrateful what I'm about to tell you, but I worked my whole life in tons of schooling and residency where it was before the work hour restriction, and we were there for over 120, 130 hours a week to become a surgeon. And I wanted to have a healthy, thriving practice. And once I got there, after about 6 years in, after training, I was at the place that I always wanted to be. I had a really busy practice, and the surgeries were going well, and referrals were not a problem, and my clinics were full. And I was starting to feel like a hamster on a wheel. And this was a blind spot that I didn't have. I sometimes wonder, like, if I could have a time machine and go back and talk to my 20-year-old self, I might have told, and I probably wouldn't have listened, but I might have said something like this. And this, I'm curious your thoughts, Bobby, whether this is true in other professions. But in medicine and surgery, we're told when we're medical students that it's lifelong learning. And that's one of the magics of our specialty. And I think that it is somewhat of a bait and switch. We have massive learning curves in medical school, and then we have another massive learning curve in training, a learning curve when we get out on our own. But after that, it can plateau. And, our knowledge base gets to be so vast. It's not that we stop learning. We do keep learning, but there's small increments. Like I adjust the framework that I have for something by a little bit, or there's a new medication for this construct that I know very well. And what I found out about myself is that I just really love learning. I love learning, and I felt a little bit stagnant. Now, people might say, well, you can do research and you can do this and you can do that. And they're absolutely right. But that's what I wish I had told myself when I was younger. Not necessarily don't do this profession, but pause for a moment. Think about yourself in your mid 40s and 50s. Mm-hmm. And I would say to myself, the actual decision-making and maybe even the surgery is not going to be as challenging as you think. What is going to keep lighting your fire? Find something and start planting the seeds of something else. So just for example, that could be maybe you want to get into hospital administration type work. Maybe you want to do entrepreneurial things. Maybe you want to do research. Maybe you want to do teaching. But you can't suddenly get to that point, or it's hard to suddenly get to that point and then start from scratch. You have to lay the groundwork. And I think I probably wouldn't have believed this if I had heard it back then. But, that's been the hardest lesson for me.
I've had similar lessons. One time I worked for 10 years. I worked my way up to CEO, was executive. And, I liken this, what I'm going to say, it's not done with arrogance, but, if you have 10,000, 15,000 surgeries, okay, the likelihood that the 15,000 and first one is going to be unique and different to the prior 14,999 or some version of one of those is probably highly unlikely. And, I found myself at one point, I was 38 and I was a CEO, and there wasn't a day that someone wasn't coming into my office with an issue, problem that maybe a sentence into it, I already knew what the question was that was going to be coming, and I knew what the answer was. And I went, wow, this is what I'm going to do for at 37, 38. I'm going to do this for another 20 years. And the answer to that was no. And I took off and did something completely different. Now, I had one other goal, just in terms of goal orientation and not being aware, and that was to retire at 55. That was my goal. That was going to be, for whatever reason, early in my career, that was going to be the benchmark. You know what? I've done it. I did it well. I made it. I did what I wanted to do. So get there. And then, after so much golfing and boating and traveling, you realize at that early age that everyone in your family is still working. Everybody in your family circle, in your work circle, in your friendship circle is working. And then on the weekends, they have to spend time with their families. And it gets very lonely. And I didn't put any thought into this goal that I was orienting myself to and driving to. And so you get yourself back engaged in different ways, which is why I'm sitting here with you today. But in terms of being in that position, I've been there a couple of times, and it totally relates to it.
I just want to pull on a thread of something you said there. First of all, I can't believe I'm floored hearing your description, because it almost feels like a Mad Libs where you could substitute like anyone else's job, and it's not unique to what I do.
Nope.
But when you're describing somebody coming into your office and you've kind of solved that problem already, you see it, to the end. So imagine, for me, I can start a surgery now and I see the whole thing to fruition, like within 5 minutes. But then you actually have to do it too, right?
Yes.
And I'm not saying I've lost engagement in surgery. I still feel very engaged, but it can be a mental challenge. Similarly, it's routine. Yeah. I like to prepare for my clinic beforehand. So the day before, the couple of days before, I'll review the patient so that when I'm seeing patients, it goes more efficiently.
Yeah.
I can basically, I don't know how this is going to sound, but I can basically go through the whole day and I know what every patient needs without seeing them, with some occasional exceptions.
Yeah.
And you might say, maybe this is a glass is half empty way of looking at this, but that can feel, we want to feel like a professional. We don't want to feel like a robot. And so
no, that's correct.
I think that's really at the heart of some of these burnout issues. And I definitely felt burnout, and that was part of it. Anytime you feel like you've been through this algorithm before, you've made this decision already 100 times, it can be a challenge.
So what have you done to stimulate yourself when you realized that you were having that experience and you're struggling with it? What have you done?
The answer to that has varied over time. In my current job, I continue to be very invigorated by the teaching aspect of it, because you're interfacing with someone else for whom the thing is new, right? And so some of that excitement that you used to have kind of rubs off, and you remember the same excitement. And if you happen to be lucky enough to hand somebody a light bulb moment, that feels really good.
It's awesome. Yeah.
Yeah. And then, so that's teaching is a way of making things feel new over and over again.
Yep. I agree with you.
Yeah. So that's
other varied interests though. Have you branched into other areas of focus?
Yes. So I have, I was talking to somebody on another podcast actually, and she said, you're a reluctant entrepreneur. And so I did become an entrepreneur, and I think she's right, somewhat reluctantly. I stumbled on a problem that wouldn't leave me alone. It just would not leave me alone. So
yep.
Because of that, I had a sense that it might be a good problem to solve. And so that has reinvigorated me intellectually over the last 2 years to a huge degree. So we could talk about that if you want.
Yeah, I'd like you to expand if you could. What specifically are we talking about?
Yeah, so around 2015, 2016, I noticed this sort of hamster on a wheel feeling, and I pinpointed exactly what the problem was. I had all these talks, like canned talks, spiels in my clinic that I would give to explain the top 15 things that fill my clinic. And I would enter into my spiel. And one time in particular, I was explaining prostate cancer to an engineer, 68 years old. And I launch into it, and I've given this spiel in so many different variations. You have no idea. I have a 20-minute version, a 10-minute version, a 2-minute version. And I got through it, and I did not remember giving it. Okay. I was sort of like, autopilot. And maybe that shouldn't have bothered me, but it really bothered me, because I truly enjoy, and to this day, I enjoy sitting and meeting a new person, a patient. I'm meeting another person. I love talking to people about what their job is and what their occupation is, and then gaining their trust enough to allow them to have me treat them for whatever they're seeing me for. I love that. When you enter into a spiel like that, you're all of a sudden a robot, and you're like, you've pulled yourself out of that human interaction that you love so much. Now you're kind of only half there. So I thought, God, this is terrible. This is not the doctor that I wanted to be when I was in college,
right.
in the ER. This is not I'm nobody's role model right now.
Right.
So what I did was I thought, geez, there's a prostate cancer guide. It's a PDF. It's 80 pages, and it's fantastic. It's geared towards patients, and the National Comprehensive Cancer Network puts this out. So I told my secretary, I said, listen, for the next bunch of patients who are seeing me for prostate cancer as a second opinion, can you email them beforehand this PDF and ask them, say, Dr. Keynes wants you to read this. And not everybody read it, but the patients who did, that visit was like, oh my God, it was like a veil was lifted. And
Yes.
it was super engaging for me. It was super engaging for the patient because all the basic stuff they prepared while they were at home.
Yep.
And then there are very few things in life that are win-win for both parties, but this was like a win-win, better for the patient, better for me.
Yep.
And I'm not, I don't mean to suggest that the clinic needs to revolve around my emotions. It's not like an ego thing, but at the same time, doctor burnout is a problem. And if you want a doctor to keep doing something for 30 years, you better make it at least palatable.
Absolutely.
So this thing happens. And I think, my God, this is great. Now, I'm not thinking as an entrepreneur yet, but I take it a step further and I recorded a video of me explaining one of the top procedures that I do. And I thought, I'm going to send patients to this video beforehand. And when I did that, I thought, this is a gamble. This is either going to be delightful for the patient or that's really going to piss them off. Like, who's this doctor?
Probably both.
Or probably both. Like, who's this doctor? Why does he not want to explain this to me?
Right.
In person? So nobody reacted that way, actually. And the reason is the conversations were starting on step 4 instead of step 1. So these patients got even more of an in-depth conversation than someone who didn't go through the material.
That mix-up was making you have to be on your feet and think differently than what you had gone into a habit of doing.
Exactly. You got it. So, and I would much rather be on my feet. I would rather not predict what the patient's going to ask me.
Right.
And then I feel like I'm using my brain. I mean, the situation you described being a CEO, the problem there is you're not using your brain anymore. You're like,
you've done it. You've done, the same thing is repeating. There's only so many different HR issues. There's only so many, business related issues, right? And unless you're going to do an acquisition or a merger and there's the complexities of doing that. Yeah, no, it's the same stuff in whatever the field, law or medicine or engineering or, whatever, right?
Yeah, I love hearing you say that because here I am for a while thinking that this is a Dr. Burnout is like a unique thing. It's really not a unique experience. So anyway, are you familiar with Linktree when people are on Instagram and they have a link in their bio that becomes a stack of buttons?
Yeah.
Okay. So this Linktree comes out and I see Linktree and I think, oh my God, this would be a nice way for me to organize all these things that I want my patients to read and watch. So I made a little Linktree type page for myself and I put all my resources on there that I wanted my patients to review. And that was the birth of what would later become Well Prepped, which is the company that I started within the last 2 years. So, but mind you, I tell you, I'm a reluctant entrepreneur because at this point, I'm only scratching my own itch. But it made my life so much better that I tested it out with 10 friends of mine, 10 or 15. I can't remember. I called on some urology friends around the country and I said, hey, if I make you a sample page, can you try it out with your patients? And they did. And then I realized it wasn't just me. So my colleagues were like, dude, I put my page QR code on my business card because I just now at this point, I want every patient to go through my favorite resources. Now I can't do clinic without it.
Right.
So, so that's the moment where I decide, all right, this is too important to not try to spread to as many doctors as possible because I know the burden myself. I know how it feels if it can be lifted even in a small way like this. And, so my entrepreneurial journey began. And I'll tell you that thing that I thought about myself that I love to learn has been true of this journey because now I'm like a kid in a candy store and I devour podcasts about software product management and small business financing. And It's almost like I'm going to business school, but I'm like, I have my own curriculum.
Right. Yes,
And,
absolutely.
and I feel like I'm getting an MBA by being thrown into the fire and just having to figure stuff out.
Absolutely will. What,
Yeah.
how much time what percentage of the week do you dedicate to this?
Yes. So right now that's a small problem. I mean, I'm still full-time practicing urologist. And so I'm waking up early. I'm going to sleep late. The bookends of my day are now filled. I now no longer have any, sort of downtime. There's no downtime anymore, but I'll tell you that it is part of the reason why I know that this is what I should be doing right now is because I'm excited to take a bite out of the next thing. Yeah. I'm like, the to-do list, it just keeps growing and I just love trying to whack it down and, keep chomping away at it.
And is there a place again? Is there somewhere where the listeners can go to see?
Yeah. So the best place to go is wellprepped.com. It's WELLPREPT.com. Well prepped. And on that landing page, you can learn a little bit more about what it is. But in a nutshell, it lets doctors send homework to their patients so that when they arrive to clinic prepared, the day goes better. It's as simple as that.
Good. That's very good. You had mentioned a couple of very influential people early on that kind of drove your interest, either to be around them, to be exposed to them, to continue to work with them, which was into urology. Whether it's them or someone else, is there someone that the listeners may not know, but they should know?
Yeah. Sometimes, I'll tell you, one of the most influential mentors in my life is not somebody who's well known, but I want to talk about this person anyway, because he was so influential to the way I think and the way I solve problems that I owe a lot to him. So he was a urologist who trained me in my residency program. Very well respected by his colleagues. He's now retired. He was a very clear thinker clinically. And it just so happened that he invented a bunch of devices that really took off and are still to this day commonly used in urologic surgery. And I had a lot of conversations with him about what it takes to invent something, to the point where as a young surgeon, I thought that was the goal I was initially chasing. I want to solve some kind of surgical problem and invent a device. And his advice to me was, unless you're looking for problems to solve, they won't all of a sudden smack you over the head. It's very unlikely. And his sort of mental heuristic was that most people go through their day trying to get to the end of the day and then go home.
Yes.
Even highly trained professionals. And
Correct.
very few people and so very few people are sort of on the prowl looking for, like, this process sucks. Like,
right.
Why does it suck? And how could I make it better? And so for the first 10 years in practice, I just have to be honest with you, nothing occurred to me. I didn't even though I was priming myself to look for a surgical problem to solve, I came up with some very mediocre ideas. And the way you have a mediocre idea is you're really excited for like 48 hours. And then a few days later, you're like, that was,
you see all the reasons why I don't want to do it.
Yeah. You're like, that's it. But the reason why I bring it up is because that is a frame of mind of looking for problems and inefficiencies. I think that's what allowed me to see the problem in my workflow and then to look for a software-based solution for it. So I
don't necessarily think about things from an inventing problem, engineering something to solve a particular issue. What I did do as an executive, though, is I'm looking for revenue streams within the business. So is there how can I monetize something else that we do well that others could, so you were looking for organic ways to create revenue streams and thinking about monetizing. And so you're looking at the business critically and all the components of it, but never like, nothing so original that I'm going to create Tesla or SpaceX, or I'm
Right.
going to
Oh,
create
I see what you're saying.
Yeah.
But still, that's a great example because unless you actively give yourself that frame of reference, you're not going to be showering one day and be like, "Oh my God, I just thought of a new revenue stream."
Yeah, exactly. So
yeah,
today I had a call with somebody. He's 2 years out. I'm going to shift gears with you for a second. He's 2 years out of residency and fellowships, and he's got a very narrow area focus with pulmonology and oncology, and he had 3 fellowships. So it was an interesting discussion, but for the people like him, or I was recently in Scottsdale with a bunch of physicians, and I was sitting with a mother who was out in Scottsdale visiting with her husband, who was just out of residency, and they're living in an apartment. They're making $60,000 a year for the last several years with a kid, and they have the debt of $250,000 or $300,000. What do what have you done with all the years since you have gone into practice to invest, to pay off your loans, to get yourself diversified, and how did you make time to do that?
All right. That is, I love this question because we didn't talk about this before the podcast, but one of my passion projects over the years has been that I teach personal finance 101, personal finance and investing 101 to other doctors. Okay?
Wow. Okay.
I have this lecture that I've massaged and improved over the last 10, 12 years. And it's a lecture that I've given around the country virtually. And it's funny, the mentor who we just spoke about when I was in training was the one who turned me onto this topic. And before I get to your question, I'll just tell you briefly, when I was a 4th-year resident, I knew nothing about investing, personal finance. And my co-resident says to me, I have a Roth IRA. Do you have one? And I said, what's an IRA?
That?
What's a Roth? And I sort of panicked, like, oh my God, I don't know anything.
I'm behind the curve. Oh no.
Yeah. So I asked my attending staff who was training me, and they didn't know anything except for this one guy. And he said, read these 3 books and you'll be fine. So for me, the journey to learn about this for me ends up in, index fund land. And once you kind of come to that conclusion, the whole process becomes somewhat peaceful and low stress. Right. So from an investing standpoint, thank God I came to that realization early, and I've never really stressed out about that stuff, even through market turmoil, because I what I tell other doctors is, you need to read 3 books to know more than most anyone about this topic. It's pretty straightforward.
Simple and amazing that it only takes 3 books.
Yeah. But more to the point, for doctors, it's actually crazy, because if you don't read those 3 books, you will get absolutely fleeced by somebody for charging you, say 1% of assets under management for the rest of your life.
Right.
Yeah. So that's my answer from an investing standpoint. From a digging yourself out of loan standpoint, I made some mistakes early on that I wish I hadn't. And have you heard of the white coat investor?
I have. In fact, I was when I said that I was in Scottsdale, I was at White Coat Investors for financial literacy for physicians. This was a couple of weeks ago. So yeah, I was there.
Yeah, that's great. So Jim Dolly is fantastic, and I did not follow his advice, but what he preaches is that you should live like a resident for at least 3 to 5 years after training to get yourself on firmer financial footing, and like pound away the debt in order to get yourself on stronger ground. Now, I did not follow that advice. I'll tell you, I immediately got a house that was probably too big and some cars, and I made some mistakes.
Yep.
Now, I happen to disagree with him slightly where, at that point my loans were under 3%, and I kind of feel like there's better things to do with your money than to try and pay off very low interest debt.
This is where he loses me also, because it's very well known that, you could have a 0.5% loan and he's like, get rid of that debt. And I, as a business person, I see it as free money, right? And I'm thinking about ways to take advantage of that money.
Exactly.
It's almost free.
Exactly.
So, yeah, I get lost there also.
Yeah, me too. But I think where he has a great point is, and even for myself, I've minimized this component. There is a psychological component to debt at any interest rate that is difficult to quantify. And each person really needs to do some soul searching to try to decide. There's the balance sheet side of it, and then there's like what keeps me up at night.
Yep. I think that's great advice that you're giving and that you're speaking to. And I don't disagree with you on any point you're making at all.
Yeah, but I'm glad you're asking these questions, because these are the things that I kind of wished I heard.
And it's so hard though, right? You've worked your butt off. You've worked. You seriously, right? Unless we know most physicians and high net earners have intellectual horsepower, but not everybody can, just walk in and take a test and spend 2 hours in lecture and they're the guy that kills it, right? Or the lady that kills it. There's few of those people. So a lot of people are working their ass off in college. They're missing out on parties. They're spending time in the library. They're doing extra work to get those grades, to get to the MCAT, to get the score they need, to get to medical school, to grind their butts there, to go to residency, to head to a fellowship, and then finally go. And you're like, I deserve something for this. Finally, right? I deserve a treat, right? Some intermittent conditioning and reinforcing this behavior. Please give me something. So I get that, and it's hard not to. It's hard to have the discipline to do what you're describing, but it's clearly the correct answer, right? You're now creating some cash flow. You're getting some revenue in. Just stick to. Don't change anything in your life. You've been doing this for the last several years. Just do it for another 3, 4, 5 years.
Exactly.
Let's get it done. Yeah.
I think he's on point with that. Just to bring things full circle, you mentioned all these driving smart people who decide to go into medicine and surgery. At the beginning of our conversation, we were talking about how I viewed doctors when I was a college student trying to decide what I wanted to do for a living, and I saw them as happy and fulfilled. I don't want to be a downer, but I do wonder what the perception is amongst students roaming around hospitals and clinics now, because when I walk around, I can sort of see, the ghosts of people in the same hallways from many years ago. And it looked very different. Like when I walk around now, I see people in front of screens, like everybody's in front of a computer. And we spend so much time treating screens and typing and documenting. And I do think that most other professions wouldn't stand for such a thing. I mean, do you think that's fair to say? I mean,
I think that, I hear a common theme. I talk to physicians daily, multiple physicians daily from across the country in a number of fields, just across the gamut, right? From anesthesiologists to urology to oncology to pulmonology to, general practice, across the spectrum, spine centers, all of it. And any of them that have been at this point in time in their career where you're at, 20 years out of medical school, they all describe it's different now, and it's the corporations that have made the experience different from them. I think, however, you are also talking about a cultural and social issue that I think is prevalent in terms of screen time and thumb time on all sorts of social devices. And I think that it has stunted, the experiential part of communicating with people and having contact and interfacing. And there's something in that Certainly people can be draining sometimes, but the experience of doing that with people that you like, that are like-minded, can be re-energizing. And I think people lose that and usually just have a drain coming out of them, right, from the way they do things now.
Yeah, I mean, that's a good perspective I hadn't really considered. You're saying that we're increasingly in front of screens. Everybody's in front of screens.
Everybody is.
Everybody.
Yeah, for efficiency's sake, economies of scale, efficiencies, everybody has been shoved to a screen, and even more so since the pandemic. I think it's, I have a 30-year-old son, and I talk to him about this all the time. I think he misses a tremendous opportunity in these critical years early in his career, to be 3 years out of an office and understanding the dynamics, the office politics that are important to understand in order to be successful, whatever that means to oneself. You got to learn how to manage up. You got to learn how to manage down. You got to learn how to interface with people. Understand the situational aspects of that. And when you're sitting behind a screen working virtually, I think there are skill sets that are being lost for sure. Yeah,
that's a great point. I'm so glad you said that, because I think I'm gonna quit with my myopic view that the struggles that we face in medicine are somehow unique. I really don't think they are. They're not.
I think there are some sweeping generalizations that we've spoke about that apply to what we're talking about is high achievers, people that are specialists that do well, but require, you have to put the energy into it mentally and emotionally and physically. We all are faced with similar challenges at some point.
Well, let me ask you this question, Bob, because do you think part of the issue is that most of us are just not meant to have a career that lasts 40 years, and that we're better off having chapters that last 10 years at a time where we can pivot? I
think, so I grew up, with grandparents. My father was a physician, by the way. I didn't tell you that. But so I've been around as I was growing up in my formidable years in the 70s, is when my exposure was to the hospitals. And I have my viewpoint on what that looked like and the attitude of the physicians from then till now. But when I grew up, you took pride in working at one place for 20 years or 30 years or whatever it was. That was the generations before me imprint onto my brain. It was about loyalty, and it was about, dedication and discipline and fortitude. And I will tell you now, and I tell people this often, and I tell my son this, yes, it is better to, and you won't even realize it, but most people, when they reflect back at 70 years old or 75, they'll realize that they've had 2 or 3 or 4 iterations of where they started in their career and then where they ended up. And that journey is fascinating, how you get there. But I see it all the time. And I think it's healthy. It's interesting now, this generation, and the way it's viewed upon now is that it's almost the negative. They see you in some place for too long a period. They like to see that movement going on, right?
Yep.
So that's an interesting thing. But I think it's better as a human, to your point of learning and challenging and having to do something and focus in a different way. I think it's good for us, and I think it re-energizes us. And I see nothing wrong with it to continue challenging ourselves in areas that interest us and doing a do-over, starting over.
Yep.
Nothing wrong with that, in my opinion. That's my viewpoint, though. So
I love that perspective.
Well, listen, it has been terrific talking with you. I took you for, I normally only talk to folks for about 30 minutes. We're almost at an hour now, and I could continue talking to you. Incredibly fascinating. And I hope the listeners go to your site and see some of your material and your information. But I just wanted to say thank you, David. It's been terrific talking with you. You're incredibly insightful and thoughtful. And we very much appreciate your time today.
Well, I appreciate the invite. I agree, Bob. We could keep talking for 3 more hours.
Thank you very much.